Hello, everyone. Welcome, and thank you for joining us this afternoon. My name is Rachel Smythe, and I'm the Education and Outreach Supervisor at the Caregiver Resource Center OC. 1988 Caregiver Resource Center OC has been a trusted partner for Orange County families who are coping with the physical, emotional, and financial responsibilities of caregiving. By providing families with individualized supportive services, Caregiver Resource Center OC stands apart as the only Orange County agency focusing exclusively on the needs of caregivers who are coping with a loved one's chronic illness. The Caregiver Resource Center provides family consultation, support groups, assessment, care planning, counseling, respite assistance, and community education. And here at the Caregiver Resource Center, we host a live stream each month. And last month, we had a little bit of technical difficulties with our live stream, so we were able to reschedule for today. And you've joined us this afternoon for Medicare and Medi-Cal coverage options. And today I'm joined by Beatrice Nunez, who serves as the HICAP Community Education and Outreach Coordinator for the Council on Aging Southern California. And thank you for joining us, Beatrice, and your flexibility in rescheduling with us after our technical issues last month. And I'd like to give you the chance to introduce yourself before we jump in. But before that, audience, if you've joined us on Facebook or YouTube, please feel free to ask questions or make comments with us throughout the live stream. And additionally, please do be aware that this class is recorded and will remain online. So please limit disclosure of personal details of your specific situation, and please only share what you're comfortable with staying online. And with that, I'll turn it over to you, Beatrice. Thank you again.
No, thank you, Rachel, and hello to everyone out there. Once again, my name is Beatrice Nunez, and I am a Community Outreach Coordinator for HICAP. And today we'll be talking about Medicare and Medi-Cal and coverage options available for you. So I will be going over some specific information, and then as time moves on, I could pause to take some questions that are prevalent to that section. And if you have what we call questions outside of what I'll be presenting today, we can leave that towards the end to see if we can get those questions answered for you. But it's just so great to be able to talk to everyone today about your benefits. I know that a lot of people have a lot of questions. So without further ado, we can get started. Thank you. So once again, we're here today to understand your Medicare and Medi-Cal options. Next, please. So HICAP is a program that helps individuals with Medicare counseling. And HICAP stands for Health Insurance Counseling and Advocacy Program. We provide free, unbiased Medicare counseling to here in Orange County residents and their families. There is a HICAP program that is nationwide. So nationwide, we are known as SHIP, which is a state health insurance and assistance program. And locally here in California, we're known as HICAP. Every county will have a local HICAP office. And there is a 1-800 number that we will be providing everyone who is watching today. So if you have any questions about your Medicare benefits or your Medicare and Medi-Cal benefits, you may call us at the 1-800-434-0222 phone number. If you are a resident of Orange County, then you can reach our main number at 714-560-0424. So once again, our main goal at HICAP is to provide personalized one-on-one counseling. We are able to do this in person and also over the phone. So we do partner with different community centers where you can go in and request a HICAP appointment. We also provide educational seminars like we're doing today. And we're also able to provide services in multiple languages. So if you know of anyone who is in need of a service in different language other than English, they can always give HICAP a call. We currently are able to assist individuals in English, Spanish, Korean, Chinese, Mandarin, and Vietnamese, as well as Farsi. So our main goal in the community is to help people understand their Medicare coverage and as well as their plan options, understand the coordination of Medicare and other insurance. So today that other insurance that we'll be looking at closely will be Medicare and Medi-Cal. And then also we help people apply for programs to help save them money and we address any coverage issues. So if there's any type of claims or payments and people aren't sure why they are getting billed, we can help answer those types of questions. And we also help identify and report Medicare fraud. Unfortunately, Medicare fraud is prevalent in the community, and our goal is to make sure that people are able to, one, avoid it if possible, and two, identify it. A lot of times it does not get identified and therefore not reported. So that's also important. Next slide, please. So once again, these are the topics that we'll be going over today. Medicare, we'll be talking about Medi-Cal, how Medicare and Medi-Cal coverage works together, resources available, and then just go over quickly of how to avoid fraud and abuse. Next, please. So our first overview is regarding Medicare. We want to make sure that we understand what it is, who is eligible for it, the different parts, what options do you have, and then what programs are there to help save you money. Next page, please. Medicare is a federal government health insurance program, and it provides health insurance for people 65 years or older, people under 65 with certain disabilities, and you would enroll at the Social Security Administration office. So you need to contact Social Security in order to enroll into Medicare A and B. And we'll talk about A and B in just a moment. Now, the benefits, once somebody is enrolled, is administered by CMS, also known as Centers for Medicare and Medicaid Services. This is the federal government agency responsible for Medicare benefits. Next slide. All right, so in order to be eligible, the person must be 65 years or older. The person can be under 65 with disabilities who is currently receiving Social Security disability benefits, or they're diagnosed with ALS, also known as amyotrophic lateral sclerosis, or diagnosed with end-stage renal disease, also known as ESRD. Now, the second component is that the person must be a U.S. citizen or a lawful permanent resident residing in the United States for at least 5 consecutive years. So they must meet both components, either age or disability, or U.S. citizen or permanent resident for 5 years in order to be eligible for Medicare. Next slide. So there are different parts. You may have seen this advertised out there. When we refer to Medicare Part A, we're referring to hospital insurance. This is what you're going to be used at the hospital, people who need skilled nursing facility care. Hospice care can also be covered under Part A as well. When we talk about Part B, we're referring to medical insurance. So doctor visits, specialists, out of what we would call hospitalizations that are in and out of the hospital that very same day. So same day surgeries like cataract surgery, for instance, that would be a Part B benefit. Durable medical equipment is also covered by Part B. And then we have the Part C and the Part D. So Part C and Part D, this is where private insurance companies come in and they're able to provide a coverage for you. So we'll see in just a moment how Medicare Part C works. But for Part D, we're referring to companies or private insurance companies that will cover your medications only. And the way that it would work is the following. Next slide. So when somebody has Medicare A and B benefits, they have their Medicare card. You're able to have what is called Original Medicare, or you can go and be under a Medicare Advantage plan, also known as Part C plans. So Medicare Advantage plans, Part C plans are HMOs and PPO plans. Here in Orange County, we have HMOs, PPOs, and something called POS. And what it does, it's going to allow you to have your hospital, medical, and drug coverage all under one company. You do have your Medicare card, but you can leave that at home. You'll be using the Medicare Advantage card at the hospital or at the doctor's at the pharmacy. For Original Medicare, this is known as traditional or fee-for-service. This is where you don't belong to any network and you can see any doctor that accepts Medicare. So you would have a Medicare card in your possession. You would need to take it with you to go see the doctors. You would more than likely enroll in a Part D plan. This is a plan that would cover your medications. So you would show this at the pharmacy. And then you would have secondary coverage. And you can have different types of secondary coverage or supplemental. So the two main types out there are Medicaps, which are private insurance companies where you would pay a monthly premium for, and then you have Medi-Cal. So Medi-Cal can also be used as secondary coverage, and you would be able to have either or. You could have original Medicare or Medicare Advantage plans. Here in Orange County, we're about 50-50. Next, please. So when we look at what would make you choose one way, having your benefits under original Medicare or having your benefits under Medicare Advantage, you want to consider your need for flexibility to see a medical provider that accepts Medicare. So you would need to check in with the specific provider you want to see and ask that provider, what kind of insurance do they accept? Do they accept original Medicare? Do they accept Medicare Advantage plans? Also, your willingness to work with providers within a defined network. So some of us understand what a network is, but for those of you who may not know, it's going to be a medical group. So if you like to work with the medical group, Medicare Advantage plans, everything is usually in network. For HMO specifically, everything has to be in network for items to be paid. PPOs allows you a little bit of wiggle room. You can go out of network when needed. And then original Medicare, there is no network. So the doctor either takes Medicare or they do not take it. Now, also, we need to look at referral preferences. Some Medicare Advantage plans will have you wait for a referral, whereas original Medicare, you may not need to obtain a referral to see a specialist. You can just make that appointment with your doctor. You also want to look at your lifestyle. So are you spending some time here in Orange County? Are you going to another county? Are you going to another state? If so, you need to take that into consideration. And then budget. So for people on Medicare only, budget plays a very big role because everything has a cost involved. So you want to double check what your cost would be for medical treatments. You want to double check what your cost would be for prescription drugs. Okay, next slide, please. Now, just as a friendly reminder, Medicare does not cover certain items. So Medicare does not cover dental, vision, hearing, or foot care, over-the-counter purchases, foreign travel, long-term services, and support. So please note that some Medicare Advantage plans, private insurance companies may offer these benefits, but they're not provided by original Medicare. And some of them might even be covered by Medi-Cal as well. Next slide. So for people who have Medicare only, there are two programs that can help them lower their costs when they're on Medicare. One is Extra Help, which is a federal government program that can help people with their drugs, and it pays for their drugs. It can pay for their monthly premiums. It can pay for their cost sharing, co-payments. There is a second program that can help individuals. It's called the Medicare Savings Program. And this is a state-funded program administered by the County of Social Services, and it can cover your Medicare Part A and Part B premiums, as well as deductibles and or co-payments. For both of these programs, income will be looked at. So there are income requirements that you must meet. For Extra Help, there might be asset limits that apply. And for Medicare Savings Program, they're just going to look at income. HICAP can help you in case you have any additional questions on these programs. If you're on Medicare and Medi-Cal, it is more than likely that you're already getting these benefits assigned to you. Next slide. So let's talk a little bit about Medi-Cal. Next. Medi-Cal is a federal and state government health insurance program. And please note that in California, we do call it Medi-Cal. If you were to live in another state, they're going to call it Medicaid. Or if you call the Medicare hotline, they will refer to it as Medicaid. It's the same program. We call it a different name here. Medi-Cal offers no to low cost health coverage for people who are eligible, and the eligibility requirements depends on income. And there are different types of categories. So different types of people can qualify for Medi-Cal, and the income, it may be counted slightly different depending on that category they're enrolled in. So just be aware that you can enroll for Medi-Cal at the Orange County Social Services Agency. Applications are accepted throughout the year. And if you have SSI benefits, which is Social Security Supplemental Income, you may already qualify for Medi-Cal automatically, and you may have SSI Medi-Cal. So just be aware, some people may get it automatically if they're receiving this SSI check. The benefits are administered through CalOptima Health and also through Kaiser Permanente. What this means is that CalOptima Health and Kaiser Permanente are considered our managed care plans for Medi-Cal. They are essentially an HMO for our Medi-Cal programs here in Orange County. If you live in another county, you will have other, other plans or managed care plans available to you in that county. So just be aware of that. They may call it something else where you live. Next slide. So these cards, if you're in California, this is what it's going to look like. The older version is still valid. However, people who are losing their older cards or they're applying for the first time recently, they're going to get the card on the right with the poppy flowers. So either or is acceptable. This is considered your BIC card. It's the benefit identification card. And people can look you up to see if you have Medi-Cal or not, or if your Medi-Cal is, if you have full scope Medi-Cal at the time of your services. Next slide. So these are the Medi-Cal plan member cards. So these are the Medi-Cal managed care plan member ID cards issued by the health plans. So once again, in Orange County, it will be CalOptima Health or Kaiser Foundation. So for members who are on Kaiser, you will be on the Kaiser Medi-Cal plan. And for everyone else, you will be on CalOptima Health. And this is just for your doctors to bill these companies so that doctors can get reimbursed for the Medi-Cal services they're providing. Next slide. Medi-Cal, just be mindful that Medi-Cal is secondary to Medicare. They like to be referred to as payer of last resort because they will pay last. So if you have Medicare plus other insurance plus Medi-Cal, Medi-Cal will always pay last. And the way it would work is Medicare pays as your primary for your hospital and medical services, and Medi-Cal will come in and pay the difference. So for people who have Medicare and Medi-Cal, we also refer to you as Medi-Medis, you will not have to pay for any hospital or medical services as long as you're using services that accepts both of your insurances. So that's where we have to be very careful. Now, Medi-Cal may also cover additional items that Medicare does not cover, including vision and dental, hearing, transportation. So if somebody needs a ride to their doctor's office or to pick up their medications at the pharmacy, they may be able to get free transportation through their managed care plan, whether it's Kaiser or CalOptima Health. Prescription drugs not covered by Medicare may possibly be covered by Medi-Cal. It depends on the medication. And then long-term services and support. So we're talking about caregiving services like in-home support services, long-term Medi-Cal. These are add-on benefits that are available for Medi-Cal recipients who are eligible for these add-on benefits. Next slide. So if somebody has Medicare and Medi-Cal, we do refer to these individuals internally as Medi-Medi. You will also hear the term dual eligible. This means that somebody has Medicare and Medi-Cal benefits activated. Okay, next slide. So for original Medicare, a Medi-Medi may be able to get original Medicare. They would have about 4 cards in their wallet, starting with their Medicare card as primary. They'll have a state-issued card as secondary, a CalOptima or a Kaiser card, in their wallet, and then a Part D card that covers their medications. Next slide, please. So for option 2, we're referring to Medicare Advantage plus Medi-Cal. So you would have a Medicare card, Medicare Advantage card that you would be carrying with you. And then you would have your Medi-Cal card on the side. So you can have both if you wanted to, the state issue card or the CalOptima or Kaiser card. They just need to look you up in the system to see if you have both. Next slide, please. So for people who are on Medicare and Medi-Cal, there is a third option, if you will, or it's part of the Medicare Advantage plans, but there's special plans that were created for people on Medicare and Medi-Cal who want to be in a Medicare Advantage plan that's specifically for dual eligibles. So these plans are called dual eligible special need plans, and they provide coverage for Medicare covered services and must coordinate Medi-Cal benefits with your managed care plan. So in Orange County, we have a total of 6, we call them DSMPs, or you can just call them dual eligible special need plans. And these plans would help coordinate the benefits between Medicare and Medi-Cal. So we do have 6 plans. Those companies are Blue Shield, CalOptima Health, Central Health, Kaiser Permanente, and WellCare. Next slide. So out of those 6 plans, 3 have been designated as Medicare Medi-Cal plans, MMP plans. And this is where when a Medi-Cal plan is exclusively aligned with the DSMP, both the Medicare and Medi-Cal benefits are managed by the same organization. And these plans are considered fully integrated Medicare and Medi-Cal plans, and sometimes referred to as Medi-Medi plans. The MMP plans facilitate coordination of benefits and feature integrated appeals and communication process. So 3 of the 6 DSMPs that are considered Medicare Medi-Cal plans are CalOptima Health. They have 2 of them. It's One Care Complete and One Care Flex Plus. And Kaiser has the Dual Complete South P1 here in Orange County. So depending on the county you live in, you're going to have specific MMP plans available. Next slide, please. So in Orange County, these are what the cards look like. And you're going to have one of these. And then when you use these cards, that's all you're going to show. You don't have to show 2 or 3 cards because everything is handled through one company. That one company will handle all the Medicare and Medi-Cal benefits internally. But it is an option. So it's not required for you to join these plans, but it is nice to have. It's a nice option to have for individuals who need additional coordination of benefits, or they've been having issues trying to see a doctor. These plans are supposed to be offering coordination of benefits. Next. So when you choose a plan for yourself, you need to look at a couple of items. So the first thing we want to look at is what kind of medications are you on? Are those drugs covered on the plan formulary? Every company can decide what is on their formulary and not on the formulary. So you want to double check that. You also want to check to see if there's a certain healthcare provider you want to keep. What insurance plan does that healthcare provider accept? Then you want to look at what extras are available. So some people like the fitness program where they get free gym membership. That's a great service, but you want to make sure you look out for the essentials like your drugs, your healthcare providers, what local hospitals near you accept X insurance plan. And then what plan best meets your healthcare and budget needs. So this is important, usually for people who have Medicare only, but for people on Medicare and Medi-Cal, you won't have any cost for hospital and medical, but you might have a small cost for your medications. So your drug cost could be anywhere between $0 to $5 a month, depending on the drug you're on. So just be aware of that. Next slide. So just be aware, Medi-Medis cannot be billed for hospital and medical services If you are receiving a bill as a Medi-Medi, please reach out to HICAP. It may be considered an improper bill, and there are certain things we can do in the process to see, one, why that bill is occurring, and two, is there a way for you not to get billed in the future? So you also, as a Medi-Medi, can change coverage and plans using a special enrollment period available to people who have full Medi-Cal status. So if you have full Medi-Cal benefits or status, you can change from original Medicare with the Part D plan to a dual special need plan once per month. Other special enrollment periods may apply under certain unique situations, such as somebody losing their Medi-Cal status. That happens sometimes. What do you do if you lose your Medi-Cal? Well, you would be given the opportunity to select another plan that would best meet your needs after losing Medi-Cal. So you do have the ability to make changes then. Also, some Medi-Medi members may be moving to another county or another state, in which case you would be given a special enrollment period when you make that change. Next slide. Okay, so just be careful with Medicare fraud and abuse. Be careful with anyone trying to pressure you to change plans or to enroll in a specific plan. Gift offers, if anyone is offering you a gift to enroll, be aware that that's a red flag. Also, what personal information are you giving to the individual for that free gift? Are you giving your name, your phone number, your social security? What are they asking for that free gift? Broker agent misconduct. Some people like to work with broker agents, which is great. That's fine. But you can also ask for their license number. Agents and brokers have a license number. If there's an issue with the signing up of a plan or that you were signed up for the wrong plan, there is recourse that you can take. Also, you are verifying that they are a real broker or agent. There are some people out there that are not. They are scammers and they just want your personal information to use your benefits. So be very careful about that. And then Medicare will not be calling you. Usually they will be writing to you. So please pay attention to any documents with the initial CMS, Centers for Medicare and Medicaid Services. TV ads, if it sounds too good to be true, it probably is. Just be aware that not all insurance plans are being sold here in Orange County, California. It could be that some plans are available in another state. And then treat your Medicare card like a credit card. So don't be showing it to anybody you don't know. If you happen to see people at health fairs and they, ask you if you have Medicare, you don't need to physically show them your Medicare card. It's no one's business. Okay. And then do your homework before enrolling into a plan. Next slide. So this is a Medicare and You handbook. Most of you should have this copy in your possession. If you do, you can reach HICAP by calling the 1-800 number on the back of this Medicare and You handbook. And then if you would like the local phone number, once again, that's 714-560-0424 for Orange County HICAP. Next slide, please. Okay, so these are some other ways you can get access to your benefits. You can call HICAP at any time. You can call Medicare. They have a 1-800 Medicare number. You can call your private insurance company. So if you have a Part D plan or a Medicare Advantage plan, you can call them to find out what benefits you have. You can also contact Medi-Cal offices. So Medi-Cal, the enrollment process is handled through Orange County Social Services Agency. So if there's something wrong with your enrollment, contact social services. If there's something going on with the benefits, like you need transportation or something is happening where Medi-Cal isn't paying one of the doctors, you can contact Cal Optima Health or Kaiser Permanente. Next slide. Okay, so it looks like we reviewed everything we needed to regarding Medicare and Medi-Cal. And I will open it up for questions if anyone has any. And also go back to Rachel if you would like me to clarify anything that I went over.
Sure. Thank you so much. I feel like I just learned way more than I was aware of when it comes to both Medi-Cal and
Yeah,
Medicare. So I really appreciate this. And so we do want to open it up. If there are any questions, please feel free to type those into the chat, whether you're on YouTube or Facebook. And while we're waiting to see if there are any questions, I have a couple questions that I wrote down throughout your presentation
sure.
just to get some clarification. So the first
Mhm.
question I had was because like many of us, we hear all these letters A, B, C, D, and it gets a little confusing. Um, and so, just to clarify, you couldn't have A, B, and C because C essentially is A and B together. Is that correct? Did I catch on to that right?
Well, in order to enroll into Medicare Advantage plans, which is your Part C, you must have A and B. If you don't have A and B, you cannot enroll into Medicare Advantage plans. With that being said, if you decide to be on a Medicare Advantage plan, you wouldn't um, have original Medicare benefits. You can only have original Medicare benefits, or you can have a Medicare Advantage plan one at a time. So people can make changes throughout the year from original Medicare to Medicare Advantage plans and vice versa, but you can't have both the same way. So let's say somebody says, well, I'm in a Medicare Advantage plan, but it didn't go well and I just won't show that card. I'll show them my Medicare card. The Medicare card will tell the doctor that you have a Medicare Advantage plan. So they'll be able to look you up and see what plan you have. So that's why when we go over these, we presented the cards to everyone. We want to make sure that if you have original Medicare, you're showing the appropriate cards. And if you have Medicare Advantage plans, you show those cards as well, because sometimes there may be improper, sometimes when we have cases with in regards to improper billing, it can be as simple as just showing the correct cards to begin with. That
Okay.
sometimes can help clarify the coverage, but sometimes I know it's a lot of cards and it can get confusing. So which ones
Right.
do you use? And you can always contact HICAP. We have some great websites or links that we're providing in the um, comment section or chat box section. So you can go to Medicare website. You can go to HICAP Council on Aging websites and uh, have a review of this, because sometimes it's just understanding the vocabulary, the words that we're using to describe the types of benefits we have. And we want to make sure you're aware, but it may take a little time to get there. So give us a call if you ever need help.
Absolutely. And it looks like there's a question that came in from the audience. Is there any financial advantage to a DSNP with Part C
Mhm.
premiums, I assume, versus original Medicare and Medi-Cal? If not, is there a particular reason to do it?
Well, one of the particular reasons people do it is to get better coordination of care. So these Medi plans that were created, or DSMP plans that were created, they were created with the intention to make it easier for Medi individuals, but you don't see it as a upfront. From a member's point of view, you really don't see much difference. You will see maybe better coordination of care where all your doctors talk to each other, where you might have a little bit of case management available if you need it. If you can't make an appointment with a certain doctor, perhaps the health insurance plan will help you make that appointment. So technically, as a Medi, you should not be billed. So I don't believe there's any financial advantage to having a DSNP. The financial advantage might be in the drug cost. So as I said earlier, you want to double check to see what your drugs would cost under a DSNP plan versus another type of plan or original Medicare. But you usually see it in the back end. So in the back end, the state might see a difference as to what they're paying for services on your behalf. But it's not necessarily uh, something that the consumer will see upfront with the cost, because they're not supposed to be getting charged in the first place.
Okay, so what I'm just hearing is so there's not an obvious financial incentive for as you refer to it. Now I understand the lingo as well, a DSNP program.
Yes,
But it sounds like the benefit is that coordination of care, really that kind of
yes.
ease of
people who
information and
need that
access.
coordination of care would be beneficial for individuals who need it. There are some individuals who just might need a little bit more extra, and the state uh, has implemented these new programs to help with that. So um, we can see it working for some individuals, and the nice thing is you can try it out. If you don't like it, you may be able to make a change. Now, when you can make the change, you should contact HICAP because it depends on the
Mhm.
situation. But definitely give us a call and we can tell you um, if you are looking to make a change, how you can test it and see if it works for you, because it is a benefit available to individuals who do need it. And then you also have extras. So they may be enticing with extra benefits like that free
Ah.
gym membership, or we'll give you additional eyeglasses every year, something like that. They'll have additional add-on over-the-counter benefits. They may have some of that.
Great, great. That's really very, very helpful in understanding what some of the benefits might be. And it looks like there's another question here from the audience. If we want to file a complaint for a Medicare Advantage plan, is there an entity where we can file these complaints?
So from what I know, you could always contact Medicare. You can call HICAP as well if you do need help with an appeal. However, we would want to make sure we look at the case. What kind of case is it? What kind of complaint is it for? So I know we use the word complaint, but sometimes the complaints, it may not be a complaint. It also may just be uh, uh, just like a grievance. So there is a difference between a complaint and a grievance, legal terms there. So they can
Mhm.
call HICAP and we can go over the differences of what you can do. And you can also contact Medicare directly and they'll advise you as well.
Great, that's very helpful. Another question that I had was you mentioned Part D as well. Is that something that's a required part of having original Medicare? Do you have to have a Part D plan, or is that typical, or what would that, I guess, what would your
Yes.
suggestion
So
or recommendation with that be?
so Medicare only folks it's going to work differently for people who have Medicare only. They have the option of joining, you can say, or not joining. However, if they don't join, then you get penalized. There is a penalty you pay for not having drug coverage, even if, let's say, you don't need it. That's something I hear about a lot. It's very common. I don't need drugs. Thank you very much. I don't need a plan. But people do get penalized when they don't have a Part D plan. So you probably want to pick one up. Now, if you are on a Medicare Advantage plan, your Medicare Advantage plan here in Orange County, most of them will have a Part D benefit. So for Medicare Advantage plans, they combine the hospital, the medical, and the drug coverage all in one. Now, if you have original Medicare and you're on Medi-Cal, you're going to automatically be enrolled in a Part D plan if you don't choose a Part D plan for yourself. So the uh, Medicare and Medi-Cal would automatically assign them into what we call a benchmark Part D plan, one plan that they would not have to pay a monthly premium to, but it may or may not cover all their drugs. We don't know, right? Because we don't know what kind of medications they're on. So if anyone ever runs into any problems with their drug coverage, whether it's a Part D plan or a Medicare Advantage plan, please contact HICAP. We can definitely assist, take a look at the drug coverage, and run drug comparison plans to see which plan might offer the lowest cost available for anyone who needs it. So please let
That's
us
good to
know how we can
know.
help.
I feel like, yeah,
Yeah.
I'm not sure everybody knows that there's this penalty potentially, if you're not
And it is a
selecting a
lifetime
Part
penalty
D plan.
sometimes. Now, Medis, usually the system will take care of them and automatically assign them into a plan. But I've also worked with a lot of people that may not even know what plan they have. And that also creates difficulty
Right.
because they don't have all their cards. So you want to make sure you know what you're enrolled in. If you don't, you can call HICAP, call Medicare, they'll tell you as well. And you can go from there.
Wonderful. Another question here came in. My husband has full coverage medical, I'm not sure if it's supposed to be Medi-Cal or medical, but does he need to apply for Medicare savings program when he has Medicare? Okay, it sounds like it is talking about Medi-Cal.
Yeah, it
So
does sound like
if he,
that.
yeah, so then
Yeah.
I'll turn that over to you.
So somebody who has full Medi-Cal and they're going to be, let's say, turning 65, the county will be getting a hold of the individual and they will be reassessing to see if they requalify for Medi-Cal under the new Medi-Cal program that they might be under. And so when they do that, the county is supposed to also help them apply for Medicare savings programs. Sometimes it happens automatically, and sometimes it does not. So when the person enrolls into Medicare at Social Security will send them something called, if they're receiving Social Security benefits, they will send them a letter called it's like a benefit award letter. And on that letter, it would tell the individual if they're going to be charged for Part B or not. And if they're going to be charged for Part A and Part B premiums, then they can take that letter to social services, apply for Medicare savings program, or contact HICAP. HICAP can also help you apply for the Medicare savings programs. We fill out the application, we mail it to you, and then social services will review it. So there is a little bit of a delay. Sometimes it used to be worse. It's getting better. Over time, it is getting better. Where Medicare starts, let's say it's going to start next month in April. Some people wouldn't get the Medicare savings program to start until 3 months after that. It can take up to 3 months for the systems to update because the state needs to pay for that. It can take time. So, but give us a call if you have any questions.
Great. Well, and it's good to hear that it's getting better, not worse. So that's
Yes.
good news.
Yes. People
Um,
are waiting less for that. I do
good,
see more
good. That's
people
always a good thing.
saying zero, they pay zero now. So that's good.
Okay, good, good. That's great to know. Another question here, since most Medi-Cal recipients are now being asked to choose a managed care plan, is there a possibility in the future that this could be the same case with Medicare?
That's hard to say. I really can't answer that. We just don't know. I just can tell you that for 2025, we have a lot of options available. Original Medicare is still working for a lot of people. In fact, half of the um, people on Medicare in Orange County are on original Medicare. So we just don't know what's going to happen. But for now, I can tell you it's still out there. It's still working. Sorry, I can't answer that one.
Right. Now that's good to know too um, that as of now things are fine, and so every year things change, and so none of us might be able to know that until it starts to happen. So thank you for that clarification too. And
Yeah.
um, something that just also came up was we're talking about the primary and secondary insurance, and I recall you mentioning that Medi-Cal will always be secondary. Is there ever a situation in which Medi-Cal can be primary, or is it just always going to be, I think your quote was
For
the last
Medicare,
payer?
right. So for Medicare related services, so all hospital medical, um, Medicare should always be first, will always be primary for those items. What I did mention that Medi-Cal may pay for items that Medicare does not pay for at all. So those items might be long-term care services. It might be vision, dental. Medicare does nothing with vision and dental. So in that aspect, Medi-Cal is 100% liable for those types of services, or they can pay for those types of services. Now you also have to navigate your insurance and find out where you can go to receive those services. It can't just go to any dentist or any optometry. You have to go to the ones that contract with Medi-Cal with your insurance plan. So it would be Cal Optima Health or with Kaiser. So you can call them to find out what providers you can go to.
Okay. And then in a situation like that, going back to that question that came in earlier about the SNP, DSNP, would those be situations where they would almost coordinate some of that on your behalf if you did need dental and you had a plan like
They
that?
will more than likely they will have their own benefit. So they have
Okay.
created their own benefit that you can use with their own providers within that group. So it's very helpful in that sense because all your providers are through one company. So now sometimes like dental benefits, they may still contract with another a third party company, but um, you'll get the information from one source, if you will.
Okay. Okay.
Yeah.
Okay. Looks like another question here. Does Medicare Part A or B cover for transportation?
So Medicare Part B, well, no, Medicare does not cover non-emergency transportation. It would only cover ambulance. So if somebody is using the ambulance service, that would be considered a Part B. Please note that paramedic services are getting charged separately than ambulance. It's different charge sometimes. So just be aware of that. But Medicare does cover emergency ambulance transportation.
Okay.
And then
And
Medi-Cal will cover the rest, the different types. So they have different types of transportation available. Some people just need, let's say somebody is gurney bound and they need a special type of vehicle to take them to the doctor's office. So then they would get that through Medi-Cal. Or they just need
okay.
like a taxi service.
Right.
So
And I've heard a few different things about sometimes I have heard Medicare plans that have, 10 trips per year. Would that be specifically a Medicare Advantage plan that has
correct.
that type of benefit? Okay.
Yes. So your HMOs, PPOs, they may offer some sort of transportation, X number of rides per year.
Okay. Okay, that's
Mhm,
helpful to know as well.
mhm.
Another question that I had was you also, during the presentation, you mentioned full scope Medi-Cal. Would you be able to share a little bit about what full scope Medi-Cal means versus if there's, I'm assuming the other option would be a share of cost. Um, could you
Yes.
speak to that a little bit?
So So when somebody is going to apply for Medi-Cal at the Medi-Cal office, which is here in Orange County, it's Orange County Social Services Agency, they're going to get a notice of action letter. That's what it's officially called. And on the notice of action letter, it will state what kind of Medi-Cal benefits you have. And so most people who have full scope Medi-Cal, they're going to tell you what Medi-Cal program you qualify for. So if somebody's on Medicare, a lot of times, not all the time, but a lot of times they'll be on the age blind and disabled program. So it actually listed out specifically what kind of program. If you don't have a specific uh, program on there, it could say the letter could state that you have Medi-Cal share of cost. And usually the Medi-Cal share of cost program is for people who meet the asset criteria, but don't meet the income criteria. And so income is a little bit too high for full Medi-Cal benefits. So then there is a Medi-Cal program called share of cost. It's almost where if you run into a situation where you have a lot of emergency services, Medi-Cal will cap you at an X number amount for the month. And so usually the Medi-Cal share of cost are about 600 and above. So it's usually 600 or greater. It's a pretty big number. And then if you have a Medi-Cal share of cost, that means that you don't have full Medi-Cal benefits until you reach that share of cost for that month. So once you reach the share of cost for that month, you will be full Medi-Cal recipient for that month. We see a lot of share of costs usually like in long-term Medi-Cal, people will have a share of costs they have to pay monthly, but because they're in the facility monthly, they may be able to meet it, so it's not a big deal. But people who live in the community, who live at home, who are paying rent, it may be a little bit hard to meet. So they may have access to Medi-Cal share of cost, and it's there in case you ever need it. But we understand that it is hard to pay 600 but or more, depends on how high your income is. So it could be more than 600. But um, if you need help with that, you can contact HICAP. Perhaps if you have Medi-Cal share of cost, you could look into a Medicare Advantage plan, or you could buy a Medigap as well. Um, if it's within your, budget. So what we can take a look at your options for you.
That's really good to know. And I've encountered some families where there's a share of cost, but Sometimes Medi-Cal's tricky and it's hard. Sometimes we don't understand the questions or, we didn't give the right details. And there's been situations where people have been able to eliminate their share of cost as well. And so if that's a
Yes.
situation that anybody encounters, please again call HICAP or reach out to us here at Caregiver Resource Center and we can try to point you in the right direction on how to get that resolved if possible.
Right. Right. It's just different. Um, People will have different options available and they'll see what works best for them. Yeah.
Right. And so with HICAP, just to confirm, it sounds like you're able to look at the full picture, whether it's Medi-Cal, Medicare, the special needs plans, all these different things. It sounds like anything kind of healthcare related when it comes to those
Well, anyone who
you
has
guys are it.
Medicare, yes, anyone who has Medicare and
Okay.
other insurance will be able to take a look at. Um, So yes, any Medicare beneficiary who has Medicare only or has Medicare and Medi-Cal, Medicare and Medi-Cal share of cost, we can take a look at all these types of insurances available for them. There's also people who have Medicare and employer. That happens. I have a few instances where people have three insurances. They went from 0 to 3 and they don't know how to navigate that. So we can work with them on that.
That's great. And when it comes to getting in contact with HICAP, sounds like the best way is to reach out through the phone number that you mentioned that we had on the screen.
For the
Is
phone
that the
number,
primary way?
yes, and then you can also visit our website. We have HICAP counseling locations on our website, so you can see the list of different community centers where we're able to provide services at. And you can make an appointment with our community partner, and we'll be able to see you, uh, hopefully near where you live. So you don't have to come to our main office, we can go to you. But if you want it over the phone, we are available Monday through Friday. And I believe our call center is usually up operating around 8, 9 to 4 p.m. So we are able to call you. And if you don't get us right away, please leave the best time to reach you because that tends to happen a lot. They'll call in, we'll call back, and it happens. But if you tell us what time we can call you at, we'll be able to make that happen. So thank you very much.
Yeah, and then just real quick, is there a certain amount of time that someone should reach out to HICAP? I guess in hopes of getting an appointment or meeting with someone. Is it usually, you want to call at least a week in advance, or I'm sure during open enrollment time, it might be at least a few weeks in advance. I'm sure you guys get very busy around that time.
Yes.
But do you have any suggestion on when we should reach out? How far out appointments go, or any advice
Anytime you have
there?
a question about your Medicare benefits or Medicare and Medi-Cal benefits, please give us a call or come see us at one of the community centers that we go to or senior centers near you. Uh, and as far as appointments, we have appointments available, maybe 1 week or 2 weeks out at this time. It just depends on the site. Some locations we're there 3 times a month. One location we might be there once or twice a month. But depending on the location, it will tell you on the list how many times and what days we're going in. That best works for your schedule as well, because we know that everyone has a different schedule going on. So, but phone call, you will receive a call within 1 or 2 business days at most. So that we do strive for that. And also you can reach out to us if you ever have any questions. Again, just give us a call, and we'll be able to answer your questions or make an appointment at the community center or senior center near you.
What an incredible resource. And I already knew HICAP was just phenomenal. But after again hearing all the different areas that you're able to provide support, answer questions, just what an incredibly valuable resource. And so, Beatrice, thank you so much again for joining us this afternoon to share such important information again about HICAP and Medicare, Medi-Cal coverage options. It can be very confusing, and I think you shared it in a way that was very easy to understand. Again, I feel like I learned a lot more today, and so I'm very appreciative of that. And so thank you again. And thank you for those in the audience who joined us. We hope that this information was helpful to you. And we also hope that you'll join us later this month for our next live stream event, which will be FAQs made easy for you. And the special guest later this month will actually be our own family consultants here from Caregiver Resource Center Orange County. They'll be answering questions that we frequently get asked. And so that might be about in-home care, it might be about HICAP or other advocacy programs out in the community, or long-term care. All sorts of different things will be discussed, and that will be on Monday, March 31st from 3 to 3:30 p.m. But otherwise, again, thank you everyone for your time. Thank you for joining us today, and take care, everyone. And thank you again, Beatrice.
Thank you. Have a good day.